many of you guys have had a chance or had an opportunity to visit Western Union?
I've been there twice actually. Great location, very everybody so friendly, brand new atmosphere in the building.
I toured the clinic, the dental clinic, and I found it very like state of art, very clean. The students were really friendly, and I like that all the like the black schools were together, all the professions.
So without further ado, Western University. So about Western U, we are a non-profit private health science graduate institution. We were founded in 1977 by Dr. Philip Lawrence. So though we are a newer institution, we have just unique programs. It's schools that have been around for 100 plus years. We have a little over 3,600 students. So not as many as USC, of course. But within those 3,600 students, they are enrolled in 9 different colleges in 22 different programs. And I'll give you a range of the programs as we move along in the presentation. So what is our mission statement? The mission of Western University of Health Sciences is to produce a humanistic tradition, healthcare professionals, environmental knowledge that will enhance and extend the quality of life in our communities. So what does that mean? We look at things at Western U from a humanistic point of view. So one of the big things at Western U, Dr. Philip Lawrence tells to students as well as many faculty members, we don't believe in just treating we believe in treating the patient, not treating the disease. So therefore we look at everything from a holistic point of view. As you know, the body is connected. So we don't just isolate one thing. We do everything from a whole, eating lifestyles to psychological issues, whatever's going on with you, we do that in a whole. And just one of the quotes from Dr. Philip Lawrence, skilled hands and compassionate hearts will continue to be the signature of all of our graduates. Exactly what is needed in healthcare today. And honestly, I believe that's more of a timeless quote. And just the reason being, like, we're not just there to make you great physicians, we're also there to make you better people as well too. So we're looking for you to just not grow in the medical aspect, but also from the humanistic aspect as well too. We're both from all levels to help grow. So going into the student life. Do you guys know where Western University is located? Okay, so how many of you guys here, just by a raise of hands, are Southern California natives? So for those that are not Southern California natives, Western University is, let me see, about with traffic, so you guys have been in LA for a little while now. So with traffic, we are about 45 minutes or so from USC without traffic, 30-minute drive. As Dr. Churchill will tell you, we came down here, we left a little early and no traffic at all. So we're located right where the 10 freeway and 57 meets, and we're right near Cal Poly Pomona and right up the street from the Pomona colleges. So I'm familiar with those, Claremont, Devon, Pittsburgh. And honestly, the location is just great. I'm not saying that because I work there. Honestly, it's one thing you can go snowboarding and go surfing all in the same day. Mount Baldy is right up mountain. That's about 45 minutes from the school. And then if you want to go to the beach, you can take the 10 out. Or if you want to go to Orange County, you can take the 55 out and end up, the freeway ends right there in Newport. So, great location. As far as the community outreach, so we do not have operating hospital on our campus. However, we do have a patient care center on campus. And within that patient care center, we have a dental center, as you know. We have a pharmacy center. We have the Western Institute of Diabetes. And we also have an eye care center, too. So we work extensively with members from the community. And that starts within your first year at Western University. You will be working with members of the community. And you have the student club assistants. So with the student clubs, right now currently we are over 100 clubs. We have over 100 clubs on campus. So I think that's pretty big to have. We have a student population right now of over 3,600 students, and we have over 100 clubs. So what do I tell prospective students? It's someone there for you. It's a club there for you, so you don't feel lost. They have everything there from sports. If you need help with academics or studies, we have the clubs there for that. Just whatever you're looking for. 9 times out of 10 is the club there for you. And I have the link on the bottom. I can give that to you in the presentation too. So, Western University degree, what do we offer? So, our founding college is the College of Osteopathic Medicine. So, do you guys know the difference between the DO and the MD?
Yeah.
Osteopathic medicine focuses more on like skeletal system, how you can manipulate it, but they're also an MD at the same. They basically take all the same training as an MD, but they often focus on skeletal system, how to manipulate it to benefit your patient.
Right on with that one. So with the DOs, the biggest difference between the DOs and the MDs is a DO, they can alleviate pain on the spot, whereas an MD cannot. So, you know, if you go to an MD and you're going through pain, the only thing they can do is just write your prescription. You go to the pharmacist, you get your prescription, and you leave. You're still in pain. With the DO, they can do things on the spot, which is RMN, which is osteopathic nuclear medicine. And with that, they can do a series of stretches and alignments, similar to what a chiropractor would do to alleviate the pain on site. We have the College of Allied Health Professions, and within that college you have the Doctor of Physical Therapy, the DPT entry and advanced level. So the difference between the entry and advanced is if you come in on the entry level, you're not certified already, but in advanced you are certified. And we have the Master of Science in Physician Assistant Studies. We have the College of Pharmacy, which offers both the Doctor of Pharmacy as well as the 2-year program with the International the International Postbaccalaureate PharmD. So the Doctor of Pharmacy, that's one of our newer colleges there in Western as well, and they are on a block curriculum. So the block curriculum consists of once you move along at your own pace in a sense, and once you test out, you can tell your professor that you're able to test out and move on to the next subject, and you're able to do so as well. So you don't graduate or you're done with the program and soon you just move at a faster pace. It's almost similar to Montessori school system. We have the College of Graduate Nursing, and one of the more diverse programs is the Master of Science in Nursing entry level. So what is that program? What that program consists of, it doesn't make a difference what you receive your bachelor's degree in or even your master's degree. As long as you meet the prerequisites and just the requirements, and you're eligible to enroll into this program. So it's a very diverse background. We have individuals who work in customer service 10 years on end decide that they want to be a nurse, as well as individuals who study to be nurses or study to become nurses during this program. So very diverse program, fast track program, and it's a 3-year program too. We have the College of Veterinary Medicine. So the College of Veterinary Medicine, what you think about this is work with everything from small animals to large animals to wildlife. So this is one profession too that can take you anywhere in the world. Your clinical rotations can literally take you anywhere you want. And there are only 2 vet med schools in California, themselves and UC Davis. So as you can imagine, a lot of veterinarians like to practice in Southern California, so that's a very competitive program as well. We have the College of Podiatric Medicine, and what's unique about that program is every faculty member there, they are trained in foot and ankle surgery, so they're just not isolated to studying the foot. They can work on your ankle as well. We have the College of Dental Medicine, of course, which we will get into in a second. We have the College of Optometry, which is also one of our newer colleges. And we also have the Graduate College of Biomedical Sciences. And one of the programs that fall in there is the Master of Science in Medical Sciences, which is our MSMS. So the MSMS is a post-bac program. So what is that program for? If you're looking to enhance test scores or knock out some prerequisites, that would be the perfect school program for you. If you're looking to, instead of going back, taking classes at the undergraduate level. And when you're done with this program, you do receive a master's degree too. And that is a 23-month program, so that's a 2-year program as well. So, as far as accreditation, the College of Dental Medicine is accredited by the Commission on Dental Accreditation, which is CODA, and as well as the academic side. And we are accredited by WASC. So the schools that you find in WASC, you'll find your school, you'll find USC, you'll find University of La Verne, you'll find Pepperdine, and you'll find Loyola Mountain Paramount there as well too. So we are fully accredited by WASC. Okay, so what makes Western U unique? Aside from the fact I told you that we have 22 different health programs, we also have interprofessional education. And with interprofessional education, Dr. Turchi is currently a facilitator for the IPE, and I will let him speak on that.
Anyway, I don't know of any other school that does this, and I got involved with it kind of by default. this IPE program at school. It's done in the first year, and it was kind of in my first weeks there at Western, and I was told, oh, you're going to be an IPE facilitator. What the heck is he talking about? Well, what they do is they bring together first-year students from all the different colleges, and some genius person, I don't know how they do it, but they do it. They come up with real cases. They find cases that are affected by all the different professions. So I'm in this classroom, and we're reading a case, and there's the optometry student, the podiatry, the veterinarian student, the dental student. All of them are in there, and every one of them has input into this case, whether it's talking about the patient's dog, how the dog might affect the patient's life, quality of life, things like this. It's really incredible. And I had to stop, and I said, look, I know I'm not selling this to you guys because you already go to school here. I said, but this is incredible. When you get out in the real world and you're practicing, all this stuff starts to happen kind of on its own. But you know, we're learning how everybody works together as we go along. But I know when I was practicing, not just the dental specialist, but the pharmacist and the cardiologist, these become some of your best friends because you have to consider those parts of the patient. When you know an elderly patient walks in, and they'll walk in with a piece of paper with all the prescriptions, they just hand it to you. And you know they've got some kind of infection, you want to prescribe antibiotics or pain medication. I mean, what are you going to do? Open the PDR and start reading through all her meds or his meds to figure out if something's going to be a problem? No, you call a pharmacist. And you ask them, and they tell you, no, just use this. So we really do rely on all the different professions, even as a dentist. And to start doing this as first-year students is incredible. I know it's what everybody puts down on their application, but you know, why do they want to go to Western? Oh, because of IPE, but that's having no knowledge of what it actually means. It says it on our website, but this is something to me that's really, really important, and I've enjoyed being part of it. I've learned a lot from it too, because I'm hearing things from the podiatry students about these cases that I would have never thought of. So it's such a great learning experience. And I'm not teaching these classes. They call us facilitators. So most of the information is going from student to student. I'm just kind of sitting there asking the questions, and it creates discussion. And it comes at a time that the students are very busy during their first year with a very heavy science load. But it's kind of a nice way for them to take a break. It forces them to stop studying anatomy and stop studying all the other hardcore science classes in their first year, and do something where they start to feel like doctors, because that's what they're becoming. Speaking about that, I think it's a really important environment, and I guess I should give you a little bit of my background. We were talking about before I graduated with a history degree from that other school across town. And I really didn't know what I wanted to do, but I loved history, and I didn't want to quit going to college, so I got a degree in something I liked. I feel like it's helped. It's been good for me. It's still a real hobby for me, and it's taught me how to read and how to write and look at things critically. So it wasn't a waste. So if you're not a biology major, it's okay. I know in my class we had hotel restaurant management majors. We had just about everything. So what you take as your major in undergrad is really not that important. You know, as long as you're taking, of course, the prerequisites that you all know about, and we'll talk about later as a reminder. That's really the important thing. But I felt like, you know, I really wasn't sure what I was going to do with it. I got out, I was saying again, I had a pretty crappy job, and it made me say, you know what, I really want to consider dentistry. My dad's a dentist. My younger brother ended up being a year ahead of me in dental school because he knew from the time he was a little kid. And I ended up being that one class behind. I'm 5 years older than him. So I had to go back to school and take all my science stuff, and at that point, it's no problem. I was very motivated. I was working. I knew exactly what I wanted to do, and it was a piece of cake, to be honest with you. Because when you're doing something that you know you want to do and that you love, it's not a hardship. So anyway, I went to University of Pacific, which I think is a great dental school. I had a really good time there. It's hard, but they made it as enjoyable as they can. Part of it is this humanistic approach to teaching. Now, any USC alumni will tell you this, and for years, and I don't think it's that way anymore, but for years, USC Dental School had the reputation of turning out these incredibly talented technicians, incredibly talented dentists. The work they did was better than everybody. People would look and say, oh, that guy must have gone to USC. but they were also teaching through a fear and intimidation and in a very negative way. And people would get out of school and say, thank God, I hated that, but I'm a really good dentist now. So, I mean, I think people started to think maybe we don't need to do that. My dad went to what was the school before UOP. He graduated in 1962, it was the same way. They used to see the dean coming down the hall, they would literally jump in a broom closet and hide. Well, somebody thought that was a bad idea, and at UOP, they were really the first ones that started teaching with this humanistic approach, and it really works. And it's probably one of the reasons they have a huge number of alumni that are donating to the school every year. Private schools have to take care of their alumni, their customers. So I went there, I had a really good time. I practiced for 19 years. I had to retire due to some physical issues. And I always knew I wanted to teach. I was going to teach history before I went to dental school. So I knew I wanted to do it. I ended up teaching a little bit at UCLA. I enjoyed it because I had students to interact with. The overall experience, you know, it wasn't what I knew. It was different. They're very research-based. Every school's different. UOP is very clinical-based. And every school has a little different personality. But when an opportunity came to be at Western full-time, I jumped at it because I knew that I would fit in personality-wise. The dean's an incredible guy. He insists that people that work there treat each other well, treat our students well, we treat our patients well. And so it's a really good fit for me. It's what I know. And so that's why I'm very comfortable there. I'm now an assistant professor there. I teach practice management in third and fourth years. And I'm involved with admissions and recruiting, and I also am trying to start our CD program, which is continuing education. You've got to keep going to school after you graduate. You need 50 hours every 2 years to keep your license. So to make a long story shorter, I hope, this is why I'm at Western, and some of the stuff they're doing is, to me, it's something that no other schools are doing, and I'm very, very happy there. To address the location a little bit, I think one of the things that I really like about it is the fact that if you live out there somewhere near school, and there's several different places where most of the students live, it's kind of like being in a little bubble. It's kind of like having your own little peace and quiet there, and if you need a weekend where all you're going to do is study, you just stay put, and you stay there, and it is quiet, and you'll probably be living with another student. If you want to go to the beach or the mountains or the wine country or Las Vegas or the desert, I mean, it's all there. But to have this one little place that you can go, I mean, just sitting in here, how many sirens have gone by? It's noisy here in the city. I mean, it's a hard place to go to school. You guys probably don't even hear it. You're probably used to it. But to have that little environment there where you can just sit down and spend time, either in the evening or on the weekend, I think it's a real advantage that it's kind of tucked away there and hidden. So it's a nice thing. So anyway, I guess we'll move on here and try to get through this for you guys and see what else we have. So you guys are probably more familiar with this than me because you know all the schools you're applying to and that kind of thing. How many people are applying to 10 or more schools? Raise your hand, just out of curiosity. 5 or more? So probably we're around 5 to 8 schools for most people. That's reasonable. Okay, so in your first year, we really focus on basic science. We're trying to be a school that can be very clinically strong and also do research. One of the assistant deans there, Dr. Brad Henson, is an incredible research guy. He's been there since day one. He's encouraging any faculty members, even people like me with no research background, to come up with ideas because they want to do that. But we're also very clinically focused. There's no question about it. So I never understood why schools had to be one or the other. I don't understand why you can't do both. And we're trying to do both. If you're interested in research, you can do as much as you want. I don't know if you're going to have the time while you're in dental school, but you're certainly will be encouraged to do it. Comprehensive patient care, this should be the way everybody's doing it. What that really means is that when a patient walks into your office or to a school and says, you know what, I fell off my skateboard, I broke this front tooth, I just want to get that fixed, that's it. Well, I hope in your offices someday, and I know at the dental school, we say, well, we can't do that. We have to take a full health history, we got to look at you as a whole person. We have to look at everything. We have to do a head and neck exam, we do oral cancer screening, we're going to look for decay in other teeth, and really look at them as a whole human being. So comprehensive patient care, I hope everybody's practicing that, but we really push it. being in Pomona, we have lots of opportunities to do community-based stuff. There's lots of people out there that don't have insurance, lots of kids. Even in your first year, you will be direct, hands-on with children. And as a first-year student, you're thinking, I don't know anything, what can I do? It's going to be things like showing them how to brush, showing them how to floss, very simple things. In your second year, you might start applying fluoride to their teeth, topical fluoride. But we have so many different avenues to deliver care to the community, people who need it that aren't getting it. And it's a marriage made in heaven because you guys need the patients and they need to have work done on them. So it's a really nice thing. We had a grant from a group called First 5 LA. It was like $5 million grant to help support these clinics where we are taking care of these kids in their first 5 years. The beauty of it, though, and again, I can't, and I'm not including myself in this, but it's a really incredible administration and faculty at the school. We have a dean that's in charge of community outreach. And when I first met him, I said, oh yeah, he seems like this nice, cuddly guy, and diversity, community outreach, and let's all, kumbaya, but he's not. This guy is like a businessman. He says, we have to take what we're getting from First 5 LA and figure out how to set up these clinics so they're sustainable. We're not just going to burn through the money and when it's gone say, sorry kids, it's over. This guy is brilliant, and he does it in such a kind and gentle way. But he's setting up these clinics so that they're going to be able to sustain themselves after this, using, doing everything above board, using what we can get from Medicare and Medi-Cal and Deni-Cal and all the state and federally funded programs to try to keep these things sustainable afterwards, which he told me about, and I was floored because I just thought, well, they'll use up the money and then it's gone. That's not the case. So you get a lot of exposure to a lot of patients. PCC, it's a patient care center. That's where you see most of your patients. I think you'll find that when you get out into the community health centers and those clinics, it's going to be more like real dental office. You're going to see several patients in the morning and several in the afternoon. At school, you might see one in the morning, maybe two in the afternoon. Everything is a lot slower, a lot more, it's like every dental school, just the way it is. So we have a lot of opportunities. You'll do 5 weeks as a fourth-year student out at a clinic. We have ADEC equipment in the patient care center and in our sim lab. So your first 2 years where you're not working on patients, where you're working on the typodonts and those, the units are the exact same with the exception of a fake head and a fake person there versus the clinic. So everything that's there will be the same as when you get into the clinic. So week in the life of a D1 and D2 student. It's a lot, especially in your first year, it's a lot of didactic work, a lot of science, a lot of studying. You got your anatomy course, which it's not complicated, it's just cumbersome. It's really, has anyone taken anatomy here, like the regular anatomy course? It's not really complicated when they explain how things work. There's just so much of it, and it's hard to remember. It's time consuming. You'll have lab work also that you're starting to work in the simulation lab. Something that you guys don't have to do anymore that took up huge amounts of time back in the old days because it was on the state board exam is what we call a denture setup, where you had to take these pink, you ever seen these before? It's like these pink rims, and you set denture teeth in them, and you make on this typodont, and you have to make it perfect. You have to make these teeth all interchange perfectly. And as a first-year student, it probably takes 8 to 10 hours to do it. For the state board, you had 4 hours to do it. So think about how many times you did it through those 4 years of school to get to the point where you could pass. Total time waster. It's not on the board anymore, and we don't teach it in school anymore. So that's, don't worry, they gave you other stuff to do and stuff. But a lot of it has to do with basic science. So again, you'll do community service. You're going to start to do everything in the sim lab, just like you're going to do in the clinic. So there's the sim lab, and that's the unit. It's made by a company called ADEC. It's one of the very high-end companies. And $1,000 each. My gosh. They are expensive. Don't break them. But it's exactly what you're going to use in the clinic. The sim lab is a very, very nice place. Each, as you can kind of see in the picture on the left, every station has a computer at it. So if there's an instructor up in the front of the classroom and he's demonstrating, we just did this yesterday, and he's demonstrating something, everybody gets to see it at their own computer. It's a really nice sim lab. If you haven't had a chance to come visit, you guys should. And someone up. Third and fourth year students are going to start doing more and more clinic work. A D3, a third year student, is going to spend about half their day in the clinic and about half with science-based stuff. It gets to be more and more specific. As a first year, you're talking about big stuff. As you go into your second, third year, it gets to be more system-specific and disease-specific. Why do we do that? Because if we teach you that stuff in your first year, which is what used to be done, by the time you actually sit down to treat a patient, you're like, I don't really remember that. So what we're trying to do is build this foundation of core sciences, and then start to talk about systems, renal, or whatever, and then we start to talk about diseases, so that when you sit down and you have a patient in the clinic, you can say, I understand this. You know, it's done it with a much more common sense approach now, which not very many people are doing this, but again, this is Dr. Brad Henson who's created this. And as you can see with the purple part of the pie, that's really in your fourth year, where most of your time is going to be in the clinic or out on your 5-week rotation. And this is our PCC, the clinic. Everything's done electronically. We have, again, another incredible faculty member. He's, for a young guy, he's already getting to be very well known. He's a radiologist. Dental radiology is one of the 9 dental specialties. After you graduate from dental school, you can go on and become an oral surgeon, orthodontist, all these things. You can become a dental radiologist too. There's not that many of them. Anybody familiar with cone beam or 3D imaging? You guys heard a little bit about this? You're going to learn a lot about it, and you have to as a dentist. It's relatively new. It's not going anywhere, but it allows us to see X-ray images in 3 dimensions. So before, we would take an X-ray and we would see the height and the width, and that was it. Now we take these X-rays, whether it's a tiny little one of one tooth or of the whole head, and we're seeing slices from ear to ear. We're seeing them from the top of your head all the way down, and from the front of your face back. It's totally revolutionizing certain specialties that always had trouble really seeing things in there. Endodontics, root canals, they're able to see things now they could never see before. They had to guess. And when the tooth came, patient came back, the tooth still hurt, they said, gee, we don't really know, where there was maybe a canal right behind another one on the X-ray, they didn't even know it was there. So we have one of the, really the world leaders in teaching radiology, especially cone beam. He's a young guy, he's going to be there a long time, and he was awesome. He's fantastic. I sent him to the school, by the way. I recruited him, but he wasn't even working there. But it's the kind of thing that they're doing at school. Another thing that you're going to do when you're in your 3rd and 4th year in the clinic, which I think is awesome, is you're going to have to take turns being the dentist, the dental assistant, the front office person, the sterilization person. You're going to do everything, the insurance person. And the reason we're doing this is that if you go out and let's say you buy a practice, you go work for your mom or your dad who's a dentist, and then you buy the practice. Now you're running this business. If you've never done those jobs, how can you tell if they're doing them properly? You hire people and they have you, I don't even know what to say. You really rely on these people. And if you don't understand what they're supposed to be doing because you've done it yourself, you can't really manage them. And a bad front office person, a bad back office person, I mean, they can ruin your practice or they can make your practice. I mean, I've had people throw away $1,500 handpieces in the garbage. I'm like, what? You know, oh, yeah, I forgot, sorry, you know, because they didn't pay for it. So it's really important to understand what they're doing and what their responsibilities are so that you can manage them and see how they're doing. So you get to do everything. So, let's see, these are the dates. Do you want to do this part, Greg, or do you want me to do it? Okay, sure, go ahead.
So that's just at a glance. So that's the last class size that was matriculated. It was a class size of 69. And for your ADSAS, the supplemental application, it is available on June the 1st. And there's a supplemental application fee for Western U, which is $60. And the application deadline is December 1st. So make sure you start with everything early so you can make that date is a very important date. You must get everything in by December 1st. And the class starts in August. We do not start 2 times a year, just in the fall. The ADSAS applications received, we received a little over 2,700 applications, and you see the class size of 69. And interviews at Western U are not guaranteed, so you see the amount of interviews, 1,325, and that's also including your instrument fees. So your GPA average, you're looking at a 3.32 overall and a 3.24 in your sciences. So with the overall GPA, Dr. Church can speak on that as well too, it's an average. So of course you're going to see people with the lower GPA and people with higher GPA.
Yeah, I have to tell you, and again, it's just because over the last few months, I know that I've looked at more applications than anybody. And it's our mission at Western is to find people that we think are going to be successful for lots of different reasons. And honest to God, I've seen applications that were 4.0s and had a high DAT score, but they had no dental experience, no shadowing, no dental assisting, no nothing, and no community service. They didn't get an interview. I mean, these things to me seem kind of daunting. I don't want you guys to see 3.32 and say, oh my God, I have a 3.0 or a 2.8 and get discouraged. Because there's lots of people, and there's so many factors, and we really look at all of them. It's not just about your DAT and your GPA. A lot of people start school not really knowing, what they want to do. Maybe they're not that focused. Eventually, if they really understand the science stuff, it'll show up on the DAT. And if you think you could do better, take it again. Doesn't matter. I've seen people take it 4 times, and if we see each time it's creeping up, and they're taking more classes, you're like, man, this person's determined. So as I was speaking to a couple of you guys before, honest to God, dental school isn't about the smartest people. In my class, some of the smartest people flunked out. The people who were there and they were grinding it out, the people who were 27 or 30 or 40 who said, this is it, I want to be a dentist, no one's going to hold me back, they did fine. So don't get discouraged by the grades. And I can tell you for a fact, there are some schools that will look at certain GPAs and just say, we're not even considering it. We really do look at the balance. And if we don't see a balanced application, we usually don't get an interview. And I'd say the 4 big things we look at is GPA, DAT, and then also where they went to school. Some schools are harder to get good grades than others. It's just the way it is. I have 2 kids in college right now, and so I've spent the last several years getting re-familiarized with what the good and bad schools are out there. So going to a school like USC, yeah, you're going to get more credit than someone who went to Podunk U, where maybe it's really easy to get good grades. So that's taken into consideration too. The other 2 really important things are exposure to dentistry, whether it's just simple shadowing, or if you're a dental assistant or a hygienist or things like that, a certain number of hours, and also community service. If you're giving nothing back to the community now, this is probably not going to be a good school for you anyway. So, this is stuff that, you can put down stuff that you started doing in 8th grade if you joined all these different groups, Lions Heart, or that's what my kids do. My daughter, who's 11 years old, she already does Lions Heart. I mean, our kids have always done that, not because they want to put it on their application. I just think, they're very fortunate young ladies. I have 4 daughters, and they should give back to their community. So that's just as important. And so if we see, really bad grades but really good on this, it tends to start to balance out. So just keep in mind to do all of it, because we're looking at all of it. Not every school will, but we will for sure. Go next. Oh, the other thing that he mentioned about the early application, part of it might be because we just got accredited. It was about a week after I started. So early September is when I started at Western. We got fully accredited, which took 4 years to get it. That's how long it takes. That may have been why we had a big spike in our applications. You have to be, eventually you've got to get accredited, otherwise the school goes away. So now we're fully accredited, we got the full 7 years. So to get your applications in early is highly recommended. I mean, we saw so many good students so early that people that don't get in, it's not going to be because they're not good enough. We have way more than enough qualified. When I say qualified, again, I mean balanced applications. So if you can do it early, do it early. It really helps. You're really putting yourself kind of in a bad position to wait. I looked at some applications last night. I finally finished looking at some that came very late, and there's still some good ones in there. Not as many at the beginning, but it's to their disadvantage. They may have to wait a year. If you really want to be a dentist, that's okay.
So just looking at the application process, as a previous slide, just shows you where it's available, the assets, when it's available in the deadline, as well as the supplemental. And one thing that's important about the DAT, make sure that those scores are valid. They are only good for 3 years. So please don't submit any scores. You did well 4 years ago is not going to count for 3 years. And do you have any questions about the VAT scores?
When you guys look at applications, you guys take like science average more than like academic average, or do you focus on PAT, or how does that work?
I mean, to me, I think it's all important. I mean, the only thing that, to me, if all the scores are pretty good, the only thing to me that seems like a big problem is if reading comprehension is really low. Because, you know, even if their science scores are kind of average or a little below average, it's like, okay, well, they took the class, they're kind of getting it. With hard work, they'll get it. But if, I feel like the load is so heavy in their first year at every dental school with science, that if they're not able to read something, absorb it, and spit it back out, that's almost a bigger problem than anything.
And then,
So-
real quick, about the PAT, I've heard some people tell me that some schools like look at it a lot, and some schools like don't really regard it that much. Do you?
I'm sure that's true. I'm sure it's true. The only way I even think about it very much is if it's super high or super low. If it's super low, then you're thinking, you know, maybe they don't have that artistic. Because I see some applications that their science GPA is like, you know, 2.6, and their overall GPA is like 3.8. I'm like, there's something else you're good at. Maybe this isn't the thing for you to go into a health science. But again, you know, you never know why people are applying. At this age, some people are still getting pushed into a certain direction, but it's got to be something you want to do yourself, for sure. If you don't want to do this, my number 2 daughter, who's a junior in undergrad, told me she wants to go to dental school. I literally told her I'm going to try to talk her out of it. If she has to go to dental school, then she should go. But she has to like push it and say, I have, you know, that's how it is. That's how you succeed. Not our school, any school. But yeah, we look at all of it. We really look at all of it.
Thank you.
Yeah. Anyone? So you guys know all this stuff, yeah? You know, when we're talking about the highly recommended courses to take, and this is not to put on your application, I'm just thinking to be ready for dental school. If you can take, to me, again, this is my opinion, if you can take that anatomy course with a cadaver before, so by the time you get to dental school, you're doing it for the second time, I think that would help. It's just so much memorization. It's complicated. There's a lot of stuff in there. You know, a lot of the other stuff, I don't know. Spanish is probably a good one. I mean, Pomona, a lot of our patients speak Spanish. A lot of our patients only speak Spanish. So that's probably not a bad one either. But again, that's just my opinion for some extra stuff to do. Have you guys seen this before? This is on our website. Yeah, prospective student website. If you have a class you're taking, because I know, you know, when I see the applications, it rarely says Biology 101, you know, and then Biology 102. It's got some other description for the course. So to make sure that it's going to qualify for, you know, biology, chem, organic, or physics, just put your name of your school in there, and then you put the course in, and it'll tell you if it qualifies. So if you want to make sure what you're taking will work, this is the way to do it. It's a great tool. Okay, so that was the recommendation. We really would like to see at least 3. really the standard of care. Only people who haven't switched over to you yet just don't want to spend the money. I was one of them. I was getting done practicing. I thought, man, I'm about done. I'm not going to pay for it and then sell my practice. But that's the way to go. That's what we do. It's a beautiful, nice building. These are right across from each other. So this building here is right there. So it's just a short walk across the street when you go from the classrooms to the clinic. This is a, Greg may know more about this. This used to be a parking lot like a year ago, less than a year ago. It was just a flat parking lot for students, and this thing is almost done now. So I'll let Greg talk about it.
So what the Damier is, we know that you guys are here at USC, no more dormitories, you lose that word, you are going to be living in a luxury apartment. So these are slated to open in the fall of this year, 2014. So just some of the amenities that come along with it. You're looking at 202 units. It consists of 1 bedrooms, 2 bedrooms, as well as studios. You have a full gym. You have concierge service, so you can get dry cleaners delivered. You get your dry cleaning done. You can get your groceries delivered to you. And one other thing that was cool, like the guy who presented the Damier, he traveled all the way from Louisiana and held like an info session and was talking about it. One thing that really stood out to me, and I didn't have this in college myself, when you're done drying your clothes, you get a text message sent to your phone so you can go pick your clothes up. So, yeah. So you have wireless all throughout the building as well too. And then one other thing, you're guaranteed a parking spot. But the most important thing that I found with this building is it's only going to be limited to Western U faculty, students, and staff. So you don't have to worry about anyone from the outside community living in that building.
Okay. A little bit about the tuition. I know we don't have it in this presentation, but in terms of comparing Western to all the California schools, which is 3 other private schools and 2 public schools, we still are cost-wise more in the middle than anything. Some of the thing is that a lot of schools will charge maybe less for the tuition, but then the add-on, the kit, is very, very expensive. So our kit on top of this is the lowest of anybody. So total with all living expenses and everything estimated, if, you never know who wants to live where, it's around $96,000, $97,000 total. But the tuition is one of the lower ones for private schools. Because there's not, again, not much added on to this. And if there's any questions, again, there's the financial aid. From what I understand, talking to students the other day, it's very easy to get loans for this. I spent last week talking to a couple branches of the military about their scholarship programs. And there's lots of other things that we can, financial aid can talk to you about. There's lots of programs where you can graduate from school and you go work in a small town for 2 or 3 years, and almost your whole tuition can be erased. So it's things worth looking into. I mean, I would never stand up here and try to make you think that paying for dental school is not a major factor. As a potential parent of a dental student, yeah, I'm thinking about it too. And we can't just ignore it. You guys already paid a lot to go to school here. So it's something you have to address. You can't pretend it's not there. But I think the best thing we can do is to help you look into all the options of how you can pay it off. Because it's expensive. So, do you have questions? It's the last slide now. Oh, there's Greg's.
Just my email and phone number, and I also left my cards there too, so pick up the card.
Do you know when the next preview day is?
Yes, the next preview day, the next preview day is going to be on March the 1st. So with those info cards that you guys filled out, we'll send out the invitation to you as well, so.
I had a quick question. Do you guys have any academic dentistry programs or no?
In terms of academic?
Yeah, so, I mean, I know certain dental schools, they kind of have programs where they teach their dental students to become professors or to teach other, at different schools. So that's something that I'm just personally interested in, so.
Yeah, we don't have a formal program like that, but I have to say that our students, especially in the preclinical lab, are forced to, sounds like a bad word, they're forced to look at their own work and grade themselves. So they become their own, because eventually, if you're in your private practice, there's nobody grading you or saying, okay, that's fine, go ahead and fill it. You have to make those decisions yourself. So we're having them evaluate themselves, even as first-year students, because they don't understand what the criteria is. Why are you calling over the floor instructor to look at it. You should know whether it's good or bad. So we have them look at it and evaluate it too. We have several students who are already demonstrating the interest in that. And I can tell you this, I do a lot of different things at school, as you've heard. Anybody at our school that had any interest in doing that, I would certainly be willing to help them with whatever. We have a lot of young faculty members, haven't been out of school very long. I share an office with an endodontist. I look at him and I'm like, how could you have already gotten through college? He looks like he's about 14. He went to UOP, then he went to UPenn for his endo program, and he's been out for maybe 2 years. And there he is. He's like a full-time faculty member teaching his butt off. He gives more lectures. So we really encourage it. Yeah, that's a good question. We don't have anything formal, but the thing about it is that why they can take people like me that were just kind of off the street of dentistry, just out practicing and went through a dental program. It's kind of what you need. Now, we do have a faculty member who is huge in education. I spent an hour with him and I feel like I got a master's in education. And I can never remember his exact title. He's Associate Dean of Integration, and it's all to do with IT stuff, the way we're going to start doing a lot of online stuff, and we're going to eventually have, in the kit will be MacBooks and iPads that everybody will get loaded with the same thing. You say, oh, it's being recorded. It's not settled yet. We're working on it. It's not official, but that's where we're trying to go. So we have a whole dean that's just in charge of doing that, and he's really good with education. Also, the CAPE program, I forgot about that. I forget what that even stands for, but I go to a lot of lectures, and they talk about how to teach. It's for anybody in the whole university. They talk about flipping the classroom, where instead of somebody standing up here and pointing to bullet points, there's a lot more interaction between the faculty and the students. So that's actually very available through the university more than through the dental school. The dental school is already loaded with that. But yeah, this CAPE program, look it up on the website under the university, and there's a lot in terms of learning and educating.
I actually looked at the database thing for the classes, and for general physics, it said that the class that you have to hear is like not the general physics class that we have. It had the higher level listed, so I just wondering.
I think you should call.
With that, call admissions.
Yeah, call and speak to somebody.
Or you can email. So what you can do is just email me the question, and I'll just send it directly to admissions, and I'll have that admission up to the right copy.
Versus email. If you email him, he'll answer you right away. That's important.
Any other questions?
I think it's really cool that you guys are so pleased with the spaces and passionate about community. I was looking on your guys' website, that you guys have like service learning opportunities, and I was wondering what that exactly was, and
Service learning? Is that what your service learning
Yeah.
opportunities?
Yeah.
You mean in terms of like communities?
Yeah, yeah.
Oh gosh, there's as much of that as you could possibly. We have a clinic that's maybe half a mile from school that is part of this First 5 LA program. And I mean, students go through there as rotations, but you can do as much of that as you want. I mean, it's very available. Yes, sir.
So do you guys have any specialty programs, and if you don't, do you envision that in the future?
That's a really good question. I'm glad you brought that up, because that's a double-edged sword. Right now we have no specialty programs, but I will tell you, from my time at UCLA, I was what they call a group practice director. So I had 13 third-year, 13 fourth-year students in the clinic that I was working through treatment plans and stuff. And it brings up another point, is that when you go to Western, it's not like you have to do 18 root canals or 25 crowns or anything like that. It's all competency-based. So you could do your first crown as a competency, and you pass and say, okay, that's it. So we're not trying to get people to just do sheer numbers, because it changes the way students diagnose. which is not a good thing. And on that same note, what I would see a lot is that I would go down and screen a patient, and they would give me the chart, and I would look and say, okay, my students told me what they need. I would give it to Ryan, because Ryan needs a molar root canal. So Ryan would be very happy. He'd bring over the endodontist to get through the consult, and the endodontist would say, yeah, I think that belongs in grad endo. Patient's gone. Didn't need to go to grad endo. Grad endo wanted to do it. Because UCLA has every graduate program. They don't have none, they have 9. So that you're fighting with perio, with cross, with the implant center, with endo for those same patients. And they have a bit of a patient problem there, not enough patients. So having the specialty programs is not always a benefit. We did have, I think, 19 that applied for specialty programs last year. It's the first senior class, and they all matched and got into programs. I mean, some of them were GPR or AGD, but I mean, you want to spend 8 years in Pomona? 4 years is enough. You need to go see someplace else. Like 4 years at USC is enough. Now you need to go to Pomona. And then you want to Boston or Philadelphia or Chicago. You got to see the world. I'm sure that at some point we will. We're also the only school that doesn't have an international program, international dentist program, that already have degrees. Another group that you'll be fighting with for patients. I know UCLA just doubled the number of students they brought in, international dentists, and they don't have enough chairs, they don't have enough patients. But international students are really anxious to come. So if we have one, I'm told it's not going to be on site, so that'll be nice. They won't be battling with our students. So yeah, there's good and bad here.
In terms of like the business aspect of dentistry, like managing your own office, how much do you learn after Wilson?
You're asking the right person. I'm now in charge of all of this. We have a 4-semester practice management series, so you'll get both in your 3rd year and your 4th year, you get semester-long classes that covers pretty much everything. And to be honest, right before I came here, I was working on my lecture for Monday because it's like a blank slate. We're starting completely from scratch with the practice management, and everything we're putting in there we feel is really current and really stuff that even right now, sometimes they look at me and they just go, I'm just trying to pass whatever. I'm thinking, yeah, but you're going to need this later, so we're just trying to plant the seeds in their head. In fact, our 3rd year students, we're giving them a project where they broke them into 4 groups, and they're going to build a practice. And one had to pick a rural location, one is a city, one's a suburb, and I forget what the other one is. And each week we're giving them another component. Say, okay, now you got to go find a building. So we're talking about real, like they have to pick a city. They can't just say, oh, I'm going to be out in, back to Podunk again, Utah or whatever. No, it's like you have to pick a location, and now we're going to tell them, you need to go find an actual building for lease for a dentist in that city. There's 18 of them, so they're going to find it. And at the end, and each week we're giving them another component. You know, who's going to be your dealer? Is it going to be Patterson? Is it going to be Shine? Buy your dental supplies from? And at the end, on the 8th final week of the class, they're all going to do 30-minute presentations of their practice. And they can't be wrong. I mean, they're not going to get a C in the class, but we're just having them go through those steps for the first time. And they're going to be, you know, they're like the blind leading the blind, but there's going to be, in each group, there's going to be one of them, oh, I was a hygienist, I worked for Dr. So-and-so, oh, my dad's a dentist, and I know about this, and so they're going to learn from each other. So that's the project they have going on this semester. So they seem kind of excited.
What are the demographics of your graduate student classes?
Wow, that's a good question. I don't know off the top of my head. I don't know if you would. We really focus on trying to be as diverse as possible, and that means whether it's any category you can think of. I mean, we have people there in their 40s. We have, you know, every race known to man. We have girls. We have lots of girls. We have more girls than guys, for sure. So that's one of our things in admissions is we do look at that too. We're trying to make sure that maybe people who have been underrepresented in the past get an opportunity as long as we look like they can be successful. Because the last thing that we do want to do when we look at admissions is just have somebody come in for whatever reason, somebody's friend or somebody's whatever, Because what's gonna happen is they're gonna start school, they're gonna get in debt $100,000, they're gonna flunk out. And if you flunk out of dental school after your first year, I'm saying this to scare you, it's just the truth, you don't have 10 years to pay the money back. The money's due immediately if you don't graduate. So we really wanna make sure that we're not just throwing people in there for whatever reason. We wanna feel like they're gonna have, for whatever reason that we see, whether it's application or an interview, that this person has a great chance to succeed. Because if they don't, no matter how diverse they are, they're gonna be $100,000 in debt, and they're gonna have to go find someplace else to borrow the money to pay that back. So the doors are wide open, but, you know, at the same time, we want them to succeed.
I guess more specifically, are they mostly from California or from other states?
They have been, but we're really trying to have that not be the case. I think, and this is one of the things I told the dean when I was hired. I said, look, you know, type of school on the East Coast, it was ranked much higher as a liberal arts school, but she got in there because, you know, everybody wants to come to California. So I told them, I said, I think we should really look everywhere, not just in our own backyard. I mean, we're in California, that's a real selling point. So right now they've been more California than I would have thought, but a lot of people don't even know we're there yet. I mean, it's only been 4 years. So the East Coast kids that are freezing their butts off right now start to realize, oh, there's another school in California. We'll probably start, you know, my goal would be to have somebody from every state if we could, amongst the 4 classes. That would be fantastic. Then we'll work on the world. I don't know if that's what you wanted to hear or not.
Depends.
It's like follow-up to that, though, do you guys have like ethnicity quotas?
No quotas. No.
That's a very fair question.
There's none that I know of. It's happening behind some other door. Again, even if you guys just, you know, came and hang out for the day and just knock on my door, go, hey, remember me? I'll say, yeah, sure. You know, I'd be happy to, you know, show you guys around and let you just see the students in action. I mean, there's a wide range of personalities there, no question. It's a pretty fun place for being that. As hard as dental school is, it's a pretty fun place. Any questions?